Hello, and welcome to this presentation which aims to equip you with the knowledge you need to advocate for yourselves on your fertility journey. Why? Because fertility treatment is expensive and sometimes unnecessary, and I can guarantee that if you've had multiple rounds of IVF, at least one of those rounds was pointless because you were not armed with the right diagnostics. My aim is to help educate all people struggling with fertility to be better informed so that your fate and the fate of your future family isn't solely in the hands of your fertility consultant. Whether you're new to this, you've had several rounds of IVF, recurrent miscarriages or secondary infertility, all of this content applies to you. I'm Verity Allen, and together with my team of highly trained acupuncturists, we're making a difference, not only to couples and individuals, but to the world of fertility as a whole. I have been campaigning my whole career to change the way we deal with infertility in this country. Our provision for IVF is very poor. Our live birth rates for those people having IVF in this country are subpar compared to practically every other country, and our management of couples and women struggling with infertility is at best ill-equipped and at worst barbaric. This idea that women need to endure 3 miscarriages before they're given basic tests is wrong. And ponder this. Our current treatment for male factor infertility is to give the woman drugs in the form of IVF. This is wrong. The fact that women are denied IVF due to high BMI when the male partner's BMI isn't taken into consideration is wrong, particularly when we know that obesity affects male fertility far more than it does the female. But there's a wider socio-economic issue that drives me to educate people on this subject. We are facing an exponential crisis. Infertility is on the rise. In 50 years, sperm counts have plummeted by 60%, and there's no sign of this levelling off. They continue to decline. Without a radical change in the way we treat infertile couples and infertility in general, we will see initially a socio-economic crisis with an aged population and fewer working generation to support them, and later human extinction. If you're interested in this subject, please check out Shana Swan, PhD. Her research on this subject is both fascinating and chilling. So let's jump in. Why do you need to know about fertility? That's what your fertility consultant is for, right? Right. Except your fertility doctor is unlike most doctors you've ever visited before. Your dermatologist doesn't stand to make several thousands of pounds if they convince you that you need acne cream and only their brand of acne cream will do. When you visit your fertility consultant, you are actively engaging in a sales patter, except this one is highly emotive. And I'm not sure most people are in the right headspace to be equipped to make the right decisions when they're grief-stricken. Would you go and buy a used car the same day you found out your partner was infertile? So this is how they get you. Up until now, no one has really paid you much attention when it comes to your fertility struggles. Your GP might have run some basic tests, but ultimately sent you away and said, just keep trying. But you meet your fertility consultant who listens and provides hope that a baby is possible. It's a hallelujah moment. But then they hit you with the stats. 21% chance of a baby. Man, now you feel right back to square one. Then they hit you with the fact that for every year you wait, that stat declines. And you're thinking, oh crikey, it's now or never. Where do I sign? This type of shit sandwich strategy is undoubtedly effective at selling IVF, but what it lacks is a cooling off period. A time to gather all the relevant diagnostics and look at the actual data as it presents itself before knee-jerking to IVF. Anyone who has experience of IVF in another country will know that a decision is rarely made on proceeding with IVF without a great many tests being carried out first. My aim is to level up the playing field. Go to the fertility consultant already armed so that the data they give you isn't generic. Make it specific to you. So let's look at these stats. I'm going to throw a few figures at you. The UK fertility industry is worth about £320 million annually. The average spend for a couple on IVF in the UK is 13 to 17k. 78% of people enter into debt to fund their IVF treatment. The average live birth rate of IVF in this country for women aged 35 to 40 is 21%. So 78% of people are financially at the mercy of debtors agents for a 21% chance of success. What if I told you that acupuncture used alongside IVF garners a 65% success rate? Those are the statistics according to a 2008 systematic review of the evidence to date of acupuncture used in conjunction with IVF featured in the British Medical Journal. Now, I need to take a moment here to say that if you're watching this presentation on YouTube, Facebook or Insta, you may not be getting those hyperlinks, but if you head over to the comments, you'll see a public link to the presentation via Canva, and from there you will have access to the links. So, just a reminder of those stats, just so we're being clear. We don't yet have robust clinical trials using acupuncture that have followed the patient to fruition to get that live birth outcome. And so I accept that we are comparing pregnancy rate with live birth rate. You can get the pregnancy rates of IVF, but it varies for each age category, ranging from 34% at age 35 to 9% at age 43. Now, let's look at my own stats in our clinics. As we are in a unique position, being an established team of dedicated fertility acupuncturists with multiple clinics dotted around the south, we are able to generate meaningful data as we see a great many more patients than a sole practitioner might. We audit our own pregnancy and live birth rates. Let's have a look at them now. Average spend in our clinics is just under £1,000. The pregnancy success rate for women aged 35 to 42 was 72% in our clinics in the year just gone, 2023. The success rate for those of our patients undergoing IVF was 89%. We're incredibly proud of this, and I think it's also worthwhile pointing out here that our age category is 35 to 42, meaning that we don't see these same poorer outcomes that a 40-year-old can expect at the IVF clinic. In fact, we don't see that much disparity in outcome versus age in our clinic at all. So let's look at this in more detail. The evidence to date shows acupuncture to improve IVF pregnancy outcome to 65%. The success rate in our clinic is 89%. So why are our stats better for our patients than those in the clinical trials? Yes, I've worked for 15 years to hone our treatments to be as effective as they can be, but I believe it's really in the consultation process that we are able to make that massive leap for our patients. So what's the difference? 24%. I believe that for the majority of you, I can give you that extra 24% just in what we'll be learning here today, meaning you're going into your IVF with a 45% chance of success. Now, I like those odds. So let's get cracking. The first place to start is to understand your case in its entirety. But you can't look at the facts as they present themselves if you're shrouded in emotion. Now, something you have, which your fertility consultant does not, is a lot of external opinions. When you're on your fertility journey, you'll have a doctor or fertility consultant with their opinion. You'll have your own feelings of inferiority. You'll have your partner's feelings of inferiority or male chauvinism if he still hails from the 1950s. You'll have your dear friend who so desperately wants you to be happy. You'll have your mother-in-law who actually does hail from the 1950s, who is entirely clueless. And then you have you again, sat at the breakfast table fantasising about being pregnant. All this must be removed in order to understand your case objectively. So put on your imaginary white coat, get a pen and pad out, gather the diagnostics you have and make notes. Don't trust that because your fertility consultant said the sperm was fine, you can rule out the fact that there's a paternal factor. If I could have £1 for every time a patient has said there's no issue with the sperm, only for me to request their old semen analyses and discover that they have a morphology of 3% or a high percentage of a motile sperm. Fertility consultants, in my opinion, often don't talk about the severity of sperm pathology because they feel that they have ICSI to fix it. But a poor semen analysis ought to require further investigation, and ICSI shouldn't be relied upon as a fix-all. Now, this is what I like to call the blame wheel. I think it's a common pattern for women to blame themselves. I'm sure that's steeped in a tradition that goes far beyond our comprehension, that women have, throughout history, been a scapegoat for men. Now, I'm not trying to be a raving feminist here, but I have noticed this pattern over the years of women continuing to take the blame, especially when it comes to fertility. So let's look at the facts. I've got here the common diseases affecting fertility along with the percentage of diagnosed cases. PCOS, endometriosis and endometritis all sit around 10%. Blood clotting disorders are actually at 1% and other autoimmune diseases are around 5 to 7%. Azoospermia, which means a total absence of sperm, affects 15% of men, with semen parameters below the World Health Organization range affecting 40 to 50% of men. Therefore, the likelihood that your partner is solely responsible is 20%, and the likelihood of him being a contributing factor is 30 to 40%. So according to those stats, if you're saying, well, I have endometriosis, so it's all down to me, well, it's 10% down to you, but it's 20% down to him. Also, 20% of cases are idiopathic, meaning that the semen analysis returns normal, but the man is still infertile, something I'll talk about more in later slides. So please don't think that this is me placing the blame solely on the side of the men, but I do really want to hammer home that women, it is not always down to you. Remove these social constructs and legacy misogyny when you're reviewing your case and look at the facts. Now, I'd also like to reiterate the point here that if you've ever been diagnosed with endometriosis or PCOS, don't let that act as a red herring to the full story. It may not be the only factor. It may not even be a factor at all. Endometriosis doesn't render you infertile unless the damage is so severe that it has caused blockages of the fallopian tubes or skewed the anatomical structure. You can still ovulate and have PCOS. Endometritis doesn't necessarily render you infertile, and plenty of women have carried to full term with the diagnosis of endometritis. Be realistic. Don't add 2 plus 2 and get 6. The likelihood of you having a blood clotting disorder is 1%. Check over the obvious stuff first before jumping the gun. Don't be too quick to write yourself off due to your age. Yes, your eggs may be old and fragmented. They might also be perfectly viable at age 44, and there's another, more easily fixable problem. Don't be defeatist and don't settle for unexplained infertility. It can all be explained given the right diagnostics. Which leads me neatly on to the important bit of this presentation. Get better informed about your case and don't settle for the tests you had at the fertility clinic. They are beyond basic. I'm going to set out the diagnostics that every patient needs to equip them for a natural conception or IVF. Now, this isn't anything special. These are all the kinds of diagnostic tests you would have as a matter of course if you were having IVF or fertility investigations in another country. And although it is true that some countries have better equipment and technology which garners better IVF outcomes, they are all utilising targeted diagnostics too, something which we're not very good at in this country. So let's start with the basics. Fertility clinics in this country don't offer day 3 or day 21 blood tests simply because it poses a logistical dilemma getting women into the clinic on the correct days. Your GP may be willing to organise this for you if you are at the initial stages of your fertility journey and have been trying to conceive for over 2 years. But these simple tests are crucial and give you so much information. Your day 3 blood test must be done on day 3 of your cycle, clues in the title. It looks at FSH, LH and estradiol. From this simple test, you can ascertain how near you are to the menopause, whether you might have PCOS or whether you are short on estrogen, which might feed into a thin uterine lining. So much info in one simple test. And so I should say here that all these tests can be ordered through our team. Just click on the little arrow which takes you through to our ordering page. Each test includes a video call with myself or one of the team to discuss findings, so just be sure to select an appointment slot that gives you plenty of time to take the test and for the results to come in. You'll see on the description for each test what the turnaround time will be from when the sample is received at the lab. Or if you're unsure, drop us an email and we'll be happy to help. The day 21 test should be carried out on day 21. If your periods are irregular, 28 days. If your periods are shorter or longer, you should tweak the day you take this test. For example, if your periods are 31 days in length, you should take the test on day 24. This is a very good indicator of a positive ovulation as it checks the amount of progesterone in the blood. Please don't rely on ovulation sticks. Get a clearer understanding using a blood test. The thyroid. Gosh, this is a presentation in itself, but I will give you the bare facts. When I first started practicing, the NICE guidelines were different and they had different set ratios of what the TSH should be depending on whether you were of fertile age. About 8 years ago this changed so that they lumped everyone together, men, women, young, old, and said that a TSH below 4 was normal. However, the British Thyroid Foundation say this: If you are planning a pregnancy, you should speak to your GP to arrange thyroid blood tests and ideally aim for a thyroid stimulating hormone TSH level of less than 2.5 milli-international units per litre at the time of conception and in the first trimester of pregnancy, and less than 3 after that. And actually, we work very closely with a thyroid specialist, Dr. Conway of the Thyroid Clinic, who works to optimise the thyroid and aims for a TSH below 2. We agree that this seems to be a good level as it allows for some wiggle room to keep the TSH at below 2.5 in the first trimester. The thyroid undoubtedly comes under some pressure in early stages of pregnancy, and so if you're already starting at 2.5, you have nowhere to go. It saddens me the amount of pregnancies are being lost to poorly managed thyroids. So if your fertility consultant has said your thyroid is fine, do look at your results and get the actual figure. If it is above 2.5, you will need to organise for prescription of thyroxine, and you should ideally be taking this for 6 months prior to conception to ensure your dosage is working its best for you. Please do take advantage of Dr. Georgina Conway's team at the Thyroid Clinic online if you need support with this or need some help getting medication. I know consultants and GPs aren't always forthcoming in providing this. Now, my reason for opting for a comprehensive workup is because your GP and fertility consultant will only allow a basic TSH test. They will not include anti-thyroid antibodies, and this is an important one to uncover as this will determine whether you have a condition called Hashimoto's thyroiditis, which is a known cause of infertility and miscarriage. The amount of women going around with this condition that are completely unaware they have it and getting the right help and medication can be a real game changer. So again, don't settle for the basic test. You need the full workup to include antibodies. A basic semen analysis. It is crucial and 100% necessary to get a semen analysis. But remember, 20% of men test normal in their semen analysis but are still infertile, so don't settle. If all your other tests are normal and there appears to be no reason why you're not getting pregnant, go back to paternal factors. We'll talk a little more about sperm DNA fragmentation in the next slide, but this is an important test and really is one that men should be getting as standard. And if you are early in your journey and haven't yet had a semen analysis carried out, we can organise this for you. It's an at-home test which comes with its own little cryogenic freezer, so you can simply produce the sample in your home and a courier will collect it. The benefit of using our test is that it covers all the analytes that your NHS or fertility clinic covers, but you get the results within 48 hours of the sample being received back at the lab. You can often be waiting up to a month to obtain your results from the GP or fertility clinic. Again, it's all there on our ordering platform if you want to take advantage of that, and I recommend you book your summary call for 2 weeks' time to give time for the kit to be posted and for you to return your sample. Our fee for this is £250, which again works out cheaper than most clinics, as you'll be paying for the semen analysis and then another fee for the follow-up call, and then often another fee for an admin fee, which can be £200 plus. So there are some tests that you do need a fertility clinic for, and I think these are particularly important for those couples who are a little bit late to the game and need to ascertain what choices you have. Also, if you were born prematurely, regardless of your age now, you should opt for an antral follicle count scan, as you will likely have been born with a diminished ovarian reserve. So these tests can be useful to help you figure out the options you have available to you. For example, if you have a high COSY scan and they find there are blockages to your fallopian tubes, then you have no choice but to plump for IVF. So I think it's a good idea to understand this now rather than waiting until you're 40 when your eggs are that little bit more aged, only to discover that all these years you were trying naturally, it was never going to work. First on the list is an antral follicle count scan and an AMH blood test. Now, most fertility clinics offer this for about £300. It's often called a fertility MOT. Again, though, don't allow yourself to be scared by the sales patter. Simply use them for their diagnostic tools, listen to what they have to say, and go away and have a good think about it when you're feeling a little less emotional. An antral follicle count scan will give you an indicator of how much time you have left in terms of fertile years and is a good predictor of ovarian reserve. The anti-Müllerian hormone, or AMH, is another indicator that fertility consultants use to predict ovarian reserve. It also helps inform them of the dosage of follicle-stimulating hormones you will need during an IVF. A hysterosalpingo contrast scan, more catchily shortened to Hycosi scan, is an internal procedure where a catheter is placed through the vagina and dye is injected into the uterus through the catheter. From there, the sonographer is able to ascertain whether there is free flow of fluid through the fallopian tubes, hence no blockages. The actual procedure itself can render you more fertile, though the reason for this is not fully understood. You can access this procedure at most fertility clinics for the cost of around £550 plus admin fees, which again can be £200 plus. My advice, go anywhere abroad and have it done there for a fraction of the price. In Spain, it's a flat fee of around €250. You can usually just email the clinic to arrange the scan with no prior consultation needed. Take a painkiller that works for you half an hour before your procedure. And if you look for cheap flights, you can even get there and back in a day and probably spend no more than €500. Now, I know some of you might be thinking, well, I don't have endometriosis, so there's no need to check. There are some bacteria, ones that you may be completely lacking in any symptoms, that can cause blockages, so don't rule it out based on the fact you might have textbook periods. So let's revisit sperm DNA fragmentation. It's a test that really ought to be available to all men, as research shows that 40% of men attending fertility clinics who had normal semen analysis result also had a high sperm DNA damage result. A standard semen analysis measures your sperm count, motility and morphology, but it doesn't reveal the quality of the sperm. Only a sperm DNA fragmentation test can do that. And we know that having high levels of DNA fragmentation significantly increases the risk of miscarriage and lowers the chances of falling pregnant. Again, it's a test you would often be given as standard in most countries, and so it's one we really ought to be carrying out if we can. We like to use the Examine test as it's the most accurate on the market. You have the option here to book this test with us, but it does involve a trip to London to produce the semen sample, and so isn't always accessible to everyone. Do get in touch to talk through options, as there are other testing centres dotted around. Now, one major point to talk about here, you might go to your fertility consultant and say, I heard some woman talk on some YouTube thing about sperm DNA fragmentation and I'd like to get the test. Your consultant will likely reply with, what's the point? We have ICSI for that. So yes, the best technology they have at their fingertips for high levels of DNA damage is ICSI. But there are many other clinics, largely abroad, that have much better technology to equip them to select better sperm. So do get the diagnostic, and if levels are high, look at alternative clinics. Or, if you have time, DNA fragmentation can be improved with correct supplementation and lifestyle advice. Check out my blog article for a much larger discussion around sperm DNA fragmentation, which I've linked there if you click on the text. Now, another thing to mention is that a lot of fertility clinics are now using oxidative stress tests rather than sperm DNA frag tests, largely because they can test this in-house rather than needing to send the sample off, thereby keeping costs low. Now, whilst we know that oxidative stress is a key player that will feed into sperm DNA fragmentation, it will not show us the genetic integrity of the sperm. It can only show what the patient's propensity might be to DNA damage. And so this is why we still opt for a DNA fragmentation test, as an oxidative stress test isn't necessarily going to paint the full picture. Moving on now to discuss recurrent miscarriage, and I just want to take a moment to sympathise at just how brutal it is that women are expected to endure 3 miscarriages before they are allowed basic diagnostics. It's a real shame that you have to take matters into your own hands, but let me help you get some answers so that you can put measures in place to help prevent further miscarriages. So, something that is gaining a lot of traffic in terms of research is the importance of the microbiome. Again, I've written an article on this topic that delves deeper into the subject, which is linked there in the text. But in a nutshell, it has been shown that some opportunistic bacteria associated with BV, E. coli, ureaplasma, mycoplasma and a few others have been shown to increase the risk of miscarriage, preterm labour and stillbirth, and not just incrementally. Women with bacteria associated with BV have a 2-fold risk of early miscarriage. Now, you may be sitting there thinking, well, I've never had BV and don't have any symptoms, so that's not me. Well, Let me tell you that we run this test as standard with all our patients, and most of the women we test who are positive for BV were asymptomatic, meaning they didn't have any symptoms. Another huge reason to check for these bacteria is that we know that mycoplasma and ureaplasma have a bearing on semen parameters. In a study of men with unexplained infertility, 76% of them had a high prevalence of ureaplasma bacteria. Now, we talked earlier about 20% of men being idiopathic, meaning they have normal semen analyses but are still infertile. And because men aren't routinely checked for these types of bacteria, we can expect that some of those idiopathic cases are due to bacterial infections that can be easily remedied with antibiotics. Again, some of the better fertility clinics abroad will run semen cultures for this reason and treat accordingly. Now, again, this isn't a test you will be offered at your UK fertility clinic, but it is one you will often be asked to carry out as standard in clinics abroad. And the main reason I'm so hot on this test is because, one, it's super easy to do, just a simple at-home swab test, and you post it off. And two, if there are strains of opportunistic bacteria, then it's super simple to fix. All it requires is a course of antibiotics for yourself and your partner, since the bacteria is sexually transmissible. And in the space of 5 days, you can go from infertile to fertile. It's just a no-brainer. Again, if you want to take advantage of this test, you can book that through our online booking platform. Just click on the arrow. The fee for this is £199. Sperm DNA fragmentation test. As we discussed before, very important test, but particularly for recurrent miscarriage, as men with high levels of DNA fragmentation can double the likelihood of miscarriage. High levels of DNA fragmentation also have a direct impact on the genetic robustness of your child. We're talking Down syndrome, congenital heart defects, and autism spectrum disorder can all be as a result of fragmented sperm. But again, it can be so easily fixed with correct supplementation, which we'll talk about in a later slide. Just a reminder, there's a link there in the text to a more thorough article on this subject. Go ahead and have a read, and if you'd like the team to organise this test for you, just drop us an email or book a free discovery call to discuss. Something also to bear in mind, and just as an aside, is that if the levels of damage are high, then it would be worthwhile organising a scrotum ultrasound scan to check for structural abnormalities. Varicoceles, which are essentially varicose veins around the testicles, are very common, affecting 15 to 20% of men, and will cause high levels of DNA damage and poorer semen parameters. It's a simple operation, but afterward a man can often expect to see radical improvement in semen parameters in 3 to 6 months, provided there are no other underlying issues. If you're interested in pursuing this, you can get a scan done quite cheaply with Ultrasound Direct for £130. So, an anti-nuclear antibodies test, or ANA test, is one I do fairly infrequently, as it's one I reserve for those patients who are displaying symptoms associated with autoimmune diseases that we know have an impact on fertility. The main ones to consider there would be lupus, which is characterised by a butterfly-shaped rash on the face, fatigue and joint pain, rheumatoid arthritis, and another which is more common, affecting an estimated 5 to 20%, is Raynaud's disease, which is characterised by sensitivity to cold and fingers turning white in the cold. Women with Raynaud's have double the chance of having 3 or more miscarriages and also double the incidence of infertility. So if you suspect you have an autoimmune condition, and particularly for lupus, rheumatoid arthritis or Raynaud's, then an ANA blood test ought to be a consideration. Again, you can order this through us. For this particular test, the phlebotomist would visit you at your home to draw the blood, as the sample must be centrifuged before it's sent to the lab. Karyotyping testing is again another test that a person would be offered, often as standard in IVF clinics abroad, before you would be accepted for IVF. As such, you can pick this test up much cheaper abroad. So if you're planning on a holiday, then look up a local clinic to see if they'll carry this test out for you and your partner. Essentially, this blood test looks at whether a person has what's called a balanced translocation. This is a genetic condition whereby parts of a chromosome have broken off and attached to other chromosomes in another location. In other words, sections of 2 chromosomes have switched places. It can be entirely harmless or entirely serious, depending on which chromosomes have attached where. Balanced translocations affect 2 to 7% of infertile couples and can be found either on the maternal or paternal side. This is why it's important that you both have your blood tested. The likelihood of having a balanced translocation increases with age, but men and women of any age could carry a balanced translocation, making a natural pregnancy fairly impossible. Unfortunately, IVF isn't a fix for this problem either, and the advice would be to have an egg or sperm donor depending on where the problem lies. The reason I like to get this test carried out is because it can save you a lot of pain and suffering in the long run, not to mention money. The amount of patients I've met that have enjoyed endless IVFs that were never going to be fruitful and all could have been avoided with a simple blood test. That said, this test doesn't come cheap at £399 per person, but again, go and see if you can get this tested on holiday for peace of mind. If not, we can organise this test for you, and if you want to read more on the subject, I've linked an article there in the text. So, supplements, very important, and I think also helps our patients when you heard me talk earlier about giving them that extra 24% success rate. We have some patients we work with who don't live close to any of our clinics and so just utilise us for the consultation process. Within this, I recommend certain targeted supplements, and actually we know that it is well studied that men taking correct supplementation can improve their semen parameters by 40% in 3 months and 80% in 6 months. Now, obviously, I can't give you targeted supplements, but I can let you in on the basics that I recommend to every patient we see, and it's just 4 simple supplements. Okay, so I need to take a moment here to talk about folic acid. So, if you ask any woman in the UK what's the single most important supplement a pregnant woman should take, they will all tell you it's folic acid. But the UK and the NHS, since this is still recommended by the NHS, is entirely stuck in the dark ages on this one. So folic acid is a man-made synthetic supplement that 40 to 60% of the population can't even absorb. And a decade ago, it was proven that folic acid's natural bioavailable cousin should be used instead, which is called methylfolate. Now, thankfully, if you're taking a good pregnancy multivitamin, it will have done away with folic acid and already be using methylfolate. To my knowledge, the only pregnancy multivitamin that still uses folic acid is Pregnacare, which also just so happens to be the multivitamin recommended by the NHS. And actually, if you look at Pregnacare's newer supplement called Pregnacare Max, the only difference is that it's swapped out the folic acid for methylfolate. So please, if you're still taking Pregnacare, just throw it away, as there's a good chance you're not getting the folate from it that is crucial for the brain development of your baby. So here's my list. We like to use Cytoplan supplements. You need a good quality preconception and pregnancy multivitamin. You need additional vitamin D, which should be taken at meal times as it is fat soluble and so can't be absorbed without fats. You need a good quality EPA and DHA omega-3, preferably from fish, but vegans can choose one made from algae. Omega-3 crucially important for the baby's eye and sight development. And you need additional antioxidants to balance out the free radicals that cause oxidative stress, which has a knock-on effect to egg and sperm quality. And if you are nearing 40, you'll want to add in a good quality CoQ10 as well. Now, one thing I've not included here is a probiotic. This is because we usually ask our patients to run a vaginal microbiome test and then deliver targeted probiotics from there. But if you're not taking advantage of this test, then look for a female probiotic aimed for women that delivers a high quantity of a bacteria called Lactobacillus crispatus. I like Invivo Healthcare's FemV product, which I've linked here. Now, as a little thank you for getting this far in the presentation, I've included this discount code, giving you a one-off discount of 30% for any of Cytoplan's products. Feel free to share this code with your friends and family. And now for men. You can see the list is the same, apart from swapping out the pregnancy multivit for a male fertility one, and you can share the other 3 between you. Now again, don't use the male version of Pregnacare here. Men also need folate in its bioavailable form. I also often throw a probiotic that's useful for the male microbiome, but I often wait until the vaginal microbiome results or semen cultures are in so we can give targeted treatment. However, as a general rule, a probiotic called Phosphodophilus is useful for men. Again, this isn't an extensive list, and if we know that there are paternal factors, then we often throw some more targeted ones in, but I think these supplements give you a basic leg up in your fertility status. And again, you've got that discount code there, which you're welcome to use on Cytoplan products. And also, just a reminder, if you can't get to those links, then use the public link to view this presentation on Canva and you'll have access. That link to the Canva view is in comments. Okay, so I've just given you a rundown of the basics. It's still much more than you would get at your average UK fertility clinic. But as you can imagine, the subject is vast and there is still plenty more to it. So if you're feeling that you don't know where to begin and you're sick to death of doing your own detective work, then of course, let me do it for you. There are many more things we can test for, and you will also be given a full report of my understanding of your case, along with supplement and lifestyle advice and my recommendations for next steps. Also, you might be sitting there thinking, well, my case is far more complex. And yes, it might be. However, have a look at the diagnostics you've had. And if you've not had the basics tested or a vaginal microbiome or sperm DNA frag test carried out, then I urge you to go back to the basics, as the complexities of your case may well be acting as a red herring, and some simple microbiome support may be all that's needed. Now, I appreciate that I somewhat glossed over the fact that clinical trials have demonstrated that acupuncture improves live birth rate when used in conjunction with IVF by 67%. But this is very true. You can read the 2008 systematic review linked in one of the earlier slides. So if you hadn't considered using acupuncture to support you in your journey and would like to give treatment a try, then these are our locations. Do check online, as we're growing in locations all the time. Patients who would like to have acupuncture do require an initial consultation, so do please book in for that first using the online booking options. You can bypass the initial consultation and jump straight to treatment if you're a bit late to the game, as so many are, and have an embryo transfer scheduled imminently. Also, you will have heard me say several times that the amount of diagnostics received as standard in this country are basic compared to clinics abroad. If I have a patient that says, can you recommend a good IVF clinic, my line is always literally anywhere but the UK. Don't be afraid to travel for your treatment. Generally speaking, clinics abroad have better technology, better expertise and better live birth rates. And if you are one of those people with a complex case and many failed attempts at IVF, head straight to Serum IVF in Athens. They are really the best of the best. But if going abroad really isn't an option, then I would recommend Dr. Afana Koita of IVF Matters, and for issues relating to sperm, Dr. Jonathan Ramsey of the Lister. So this wraps up our discussions today. Just a reminder that you can order any of the tests we've spoken about today via our website. You can also book for a consultation if you feel you'd like to be supported further. Hopefully what we've discussed will equip you better to advocate for yourself in this crazy journey you're on, and give you some ideas of avenues to pursue if you are one of those people with that infuriating diagnosis of unexplained infertility. It can all be explained, you just need the right diagnostic. That's it from me, wishing you all well on your journeys. If you found this presentation useful, give us a thumbs up and share with others, perhaps on Facebook support groups or friends who are in a similar position to yourselves. Also, I appreciate that this has been very much geared to the female, but men, if you would like me to make something similar aimed specifically for you, please drop a note in the comments. Thank you for your time.